boot camp presentation was about Atlantic Canada, how there's been progress in Atlantic Canada as it relates to Infoway, but more importantly it was about bringing some real world problems home for the audience around what's happening in Atlantic Canada, which is really the start of what you're going to see across the country. So some of the key issues that other generations are going to face around healthcare and healthcare technology. And I started off by taking the first job I could get, which was a data entry clerk in the Ministry of Health. In the space of 5 years, I became the Executive Director or ADM of Corporate Services, became a Deputy Minister of Health, and then went to the private sector and worked for a number of large corporations. Went to Canada Health Infoway 10 years ago, and that's brought me full circle to implementing technology solutions in Atlantic Canada. From a business perspective, really I have 4 rules. Use common sense, pay attention to your clients, you have to pay attention to details, and if you're going to get me into trouble, then let me know before you get me into trouble. So those are the 4 things that I think have been most successful. I think probably the most daunting and most important trend over the next decade will be twofold. One, there will be a newer generation that embraces just-in-time mobile technology, and I think that will be the wave of the future for healthcare. So I think what you're going to see is a lot of these larger technology solutions will be reduced to mobile solutions. Have an open mind. Don't be afraid to challenge the sacred cows or the white elephants. And above all, build relationships. I think that you can be successful in any field, but more importantly in the health field if you have good relationships. Because relationships allow you to get through the good times, but more importantly it allows you to deal with the bad times. And I think that that's the key.
All right, thank you so much. Do you have any other comments or questions?
Nope.
Okay.
Thank you.
Thank you.